This is why I hate Comcast internet. Yes, I said it. I hate Comcast internet. This is why I said it. 100% why I hate Comcast internet. Dies some more. Oh!
So guys, I dropped the boys off. I'm on my way to my other appointment.
I'm trying to see. So, I hate Comcast internet. It just dies on you in the middle of anything. Hopefully on maybe by Friday I'll have my Fios hooked up. I'm so excited. So I probably won't have the Comcast dying problem anytime soon. Hi, Aunt Maddie. How are you? I actually had another live in our friends at Comcast and it dropped. I'm so upset. It just sucks. And we were talking about things to buy. Hi, Lala. No, it was okay. It's just that Comcast just it died. The stream ended. It showed shut. No, it's okay. But I was talking about the things that you definitely should buy, like plan when you have little kids, plan that if there are school closings for the coronavirus, that you definitely plan for your kids to be home and plan to have lunches, like buy tuna fish and peanut butter and jelly, buy the things that your kids like to eat. I got like halfway through. I was saying to buy like extra shampoo, conditioner, of course, toilet paper. Those of us affected. Yeah, somebody went to Walmart. Yes, I don't know, 50,000 box of, girly products. It's definitely essential to buy girly products because you definitely don't want to be running to a drugstore to go run and get girly products or a convenience store or anywhere. Please ensure that you have cash on hand. Also, people aren't thinking about that. Yes, it's good to have your debit cards, but yeah, you bought Pediasure. That's another thing that I was gonna say. Like a lot of times, like besides the usual, like I was saying, go to Aldi's. You can put stuff in the freezer, shop in the morning, and you can find deals on meat and stuff. Buy spices, like extra spices, condiments, stuff that you use like that. Don't buy gloves if you don't know how to use them and take them off. I think I'm gonna do a video on that and hand washing because I seen a video on hand washing and it was just no good. Anything that you can use for like electrolyte based fluids, like it's definitely Pedialyte, Ensure, Gatorade, Powerade, any kind of protein based drinks. I actually found one at Dollar Tree. I think it was called Mio, where you like drink a little bit of the water, you take a sip of the water, and then you dump the protein drink in there. I haven't tried it yet because I need a bottle of water. I'm trying to see where I put it. Let me see if I have it up here. It's kind of showing, but it's called Mio. I actually found it at Dollar Tree. So, hi, Pure Mom. This is what they look like. I bought these at Dollar Tree. So definitely if you find these at your Dollar Tree, they have 10 grams of protein, which is really, really good. Hi, Disorganized Crafter. My dog is going to irk my nerves. They're like on the go sticks. You can stick them in bottled water. So I would definitely, if you find these, I'm not sure how they taste, but you can make anything taste good. Add sugar. But it says contains milk. Stop, Nigel. But it's definitely a good thing to have if you find any of these. I can't say the good taste. I'll have to taste them and let you know. Yes, I'll buy dog food too. And you eat tuna. Oh my God, my dog is crazy. So definitely get that kind of stuff. Shop the sales. Do all those kinds of things. Go in the morning when you buy stuff because a lot of times you can find, like I was saying, like a lot of the stores out here, like you can find, like they'll have like really expensive steaks, like 50% off based on the fact that like they're 2 days out from their expiration day out or at a day out, which you can just easily freeze them and then cook them. Like it's not bad. Another thing is like that I was telling people, you're getting on my nerves, dog. Like another thing that I was saying to avoid, like get all those food basics. Hi, Daddy. Listen, I don't like Comcast. And do you want another dog? Because I got a dog who won't cut it out. You can cut it out or you can get a new home. So, and he's gone for the moment. He'll be back. But I'll translate. Make sure you see if you look for these. I have to try them. I'll put them in water. Try to be on the high protein stuff. I know they have canned tuna, canned soups. Like if you're an army of one, it's so much easier for you to try to buy a few little things extra, especially if you're not in affected state yet. Like he was saying, like toilet paper was an issue in some places. Napkins. Just saying. Transaddy. Leave it to me to buy the big box. Anyway. If we can stay with you, if you want to get the heck out of here, I don't blame you. Yes, of course. You'll be wearing masks. You'll be quarantined for 14 days in New Jersey. I'm just saying. No, I'm kidding. It's safer out here, and then you'll be with a nurse. But definitely, high blessings. Definitely bleach is your friend. I would definitely get Clorox or a reputable brand of bleach because I wouldn't want to risk you ran out of toilet paper at the job. I got 2 of these, okay? Do you see how big this box is? It's the size of my head. I have 2 of them. And pads and everything. Like, you have to get the feminine stuff. I'm sorry. It's just a part of life. Like, you have to. Like, nobody wants to be running around. Yeah. Not happening. Like, definitely get bleach. And I was saying, like, previously, make sure you wipe all the common areas with toilet paper. And please, close the lid of the toilet when you flush it. Like, you spray all those germs everywhere. And of what I understand, they've been doing rectal swabs on people in China because they think it's contagious through the poop. Yeah. That means there's many routes. Don't freak out. Well, you're in the zone of it's almost time to freak out, but don't freak out yet. Because I think you're kind of like in a little bit of a hot zone. So I'm going to call you later and I'm going to give you like a little actual list of things that you need to look for. Yeah, rectal swabs. Don't put no. Nope. That ain't happening. Anyway, don't buy stuff if you don't know how to use it or need it. That was my big thing. And I was telling you about like how to stock for breakfast. If you know you're a cereal person and you go to Dollar Tree and they got 5 boxes of cereal, do yourself a good favor and just buy it. Do yourself a solid. Buy yourself a box of cereal. If you like, I eat farina, we eat oatmeal. We have those things in my pantry. Like I could show you my pantry is almost organized and the bottom is still not done, but I have probably 20 cans of soup because when they went on sale, Progressive Soup went on sale. They were like 10 for 10 and I bought 10. And then another store had them like 88 cents. And then I bought like 4. And so as you shop, this is how you literally buy, you get a food storage. And that's what you should have for emergencies. Not only that, you lose your job, any of those things, you should 100% have some kinds of food. I don't want to say insurance, but you should have definitely have a pantry. That's okay, Aunt Maddie. Yeah, you're in the pre-freak out, but almost there zone. If you're a soda drinker, the thing that you're gonna crave the most when you can't go outside, you're gonna want that Pepsi. So I already know we don't really drink soda like that, but I might buy. Yeah, it is. It's like your food stash. And I can tell you when I was having seizures and I was barely working, like we literally I shopped in my own house. Like my kids would run out they would go down the street and get bread and milk at the convenience store. Like we have Wawa here, so it was pretty cheap. Hi, Jennifer. And we would get milk and bread from the convenience store, or I would go out to Aldi's with like a crew. They would drive, and then I would go to Aldi's and we would get like milk, bread, and eggs. But everything else literally came out of my pantry or out of my deep freezer because I was able to cook. And as I went along, I made it a point to like little by little put dates on stuff. So I had a Sharpie marker. And so if I found pork chops on sale and they were like a really good price, I'd put them in the deep freezer. I would find, I don't know, I like chicken thighs. I would put chicken thighs in the freezer if I found them for like 89 cents a pound. You get like $4 and then you put them in the freezer. Trump is I don't even want to say it. He is not listening to the scientists that are telling him, and literally the CDC is a bunch of retards themselves, because there's no way that they shouldn't have did testing. And I have my own philosophy that because they were underfunded, they're acting underfunded. Well, according to my tax dollars, you're not underfunded. Do the right thing by the American people. You should have had test kits. There was a doctor on MSNBC actually put it in a group that said the same thing. Like he gets on the train to go to New York, to one of the biggest hospitals in the United States, one of the busiest hospitals, and he doesn't have a testing kit. So he's literally got to call the CDC, call the health department, call the CDC, and literally beg to why this person should be tested. Yeah, he's an idiot. Like the scientists say one thing, and then he tries to he counteracts exactly what they say, and then people wonder why, like, hello? No, like, listen to the scientists, listen to the doctors, listen to the nurses. These are the people on the front lines. And not the dude from the World Health Organization, because he was sucking on China's, like, chopstick for a long time. Oh, they're handling it so well. Okay, well, if they're handling well, it wouldn't have got out. And then hi, Corey. I know, it's okay. And it wouldn't have been so bad, but South Korea nurses said they were the problem is in U.S. is that you pay for the test. No, actually the test is not going to be something they pay for. They're just going to test in the hospitals. The fact is that they dropped the ball. Like, to me, you wanted this to spread. Like, you wanted it to spread because you did nothing to prevent it. And I don't know about in markets and other things. Yeah, the hospitals are free because you have like that universal health care. We don't have that here. We have great health care, which is just not free health care. So a lot of the times, like, I think like it was so mishandled. Like, you had the nurses in Vietnam and especially South Korea, they were like, you're going to shut this down or we're going to strike. Like, they 100% were like, you're either going to shut it down or we're going to strike. The nurses were striking. Hence why you started seeing the nurses. They were on strike. The nurses and the medical professionals like, no, we're on strike. And they're like, no, you can't go on strike. And they're like, yes, we can, because you're not letting this come in. And we have enough flu and everything else here. And we don't have enough stuff now. You're letting more in. No, you're going to shut it down or we're just going to walk out. And then you're not going to have anybody taking care of the patients. So eventually they started restricting travel. They had to go back on their words because they had to listen to these people. It made sense. Here in the United States, although you had many, 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 many medical professionals. Hi, Burns. There's many cases in the United States right now that are underreported because we can't test them. And that's the sad part. And people need to understand the importance of making sure that they have not only for, this emergency, but moving forward for any emergency, that they always should have some sort of pantry. And you don't have to build a pantry overnight. Like, that's what we're having now, is you're having this mass panic buying because people are like, oh my God, like they're all becoming hoarders. But that's not what you should do. You should, they are asking people to self-isolate, but they're kind of like, well, maybe. Vern, where are you at? So honestly, the best thing for anybody to do is, one, if you're going to build a pantry, think about the things that you eat. That's common sense here. Like, if you don't eat oatmeal, there's no reason you should have it in your pantry because you don't eat it. Yes, it's heart healthy. I think you should try it and like it. But if you don't eat oatmeal and you eat grits, like I eat grits and farina. I love grits and farina. In New York, yeah. So, yeah, Manhattan, you have 2 cases. Girl, that's gonna be spreading south anytime now, and I'm in New Jersey, so I feel that. But 100%, those are the people that don't have a mask. Like, Pure Mom is in Washington, and I'm gonna get with her on a video chat, and me and her are gonna make a list. I'm gonna sit with her, and I'm gonna actually make a list. We're gonna talk about the stuff her and her kids eat, and her husband, and then hi, Wavy Quicks. Yeah, there are cases in the UK. There are a lot of cases in Iran that were underreported. Hence, the nurse, the medical professional, went over to Iran, returned from Iran, and came back and just worked, and now is home isolated. the one good thing about a lot of medical professionals is we have a super high immune system because everything that comes along the pike, like we're around. So our immune system, like if you get something, you don't keep it. Like you get it and it's gone. Your immune system is so strong because it sees so much stuff. Like your body is exposed to so much. Every cold that comes along, every. So a lot of times nurses don't get it, and doctors don't get as sick as much as a lot of other people. People from north of Italy who came to south must to isolate. We have a problem in the United States right now when it comes to isolation, self-isolation, and sick days. I'm going to tell you what the problem is. As a nurse, the one thing that I do have is I have paid sick leave. That is a problem. Braden, do you have paid sick leave from your job? Let me know. If anybody works a full-time job or a job, do you have paid sick leave? Because part of the problem is that you have infections that spread because there are people that don't have paid sick leave. Meaning, if you work Monday through Friday, or you work Monday through Thursday, like my son, he works at a company and he doesn't have paid sick leave because he's only a part-time employee. So he doesn't have paid sick leave. But if he takes off, he's got a mom, so he's fine. But there's people that don't have paid sick leave. So if they have to self-isolate for 14 days, that is going to be a problem because not only is it hit to them personally, financially, how are they going to make up that 2 weeks worth of money to pay their rent, pay their bills? Like most Americans are living paycheck to paychecks. At your last job, you had no benefits, no PTO. That's a problem. So people that are living paycheck to paycheck, that is a problem. Because what happens when they can't paycheck to paycheck? They're still going to try to go to work, which is going to cause this disease to spread even more. America and its bad habits and big corporate business have created these problems for the rest of us. And so I really think that we need to open our mouths and be like, no, this is not okay. You should have paid sick leave. If not, the government better step up and do 2 weeks of unemployment for these people. That they should. That's the right thing to do. Honestly, you should. If you don't have PTO, then your state should offer you if you have this coronavirus and have to self-isolate, your state should authorize 2 weeks of unemployment for you. They should. That is the right thing to do. That'll keep the economy upright. Because what happens is when people get 2 weeks behind, it's so hard to catch up from being 2 weeks behind. It's insurmountable on some people they're trying to buy food or they're trying to buy this and now they're sick. And then what if they do get the virus and then they're out 6 weeks and they don't have that compensation? 3 people that just passed away and their families. Yeah, it's very important, very, very important to for economy wise, they really have to think about this stuff. They're thinking about big corporate business along with big corporate business and big corporate business, but they're not thinking about people have to understand they're a piece of this puzzle. So in Italy, the schools are closed for a month. Yes. And people don't think in the United States that they're going to close the school. I can guarantee you hi, Jordans. Right. That's a problem. That's what I'm saying. If your kids are sick, how you stay home? You can't send them to daycare. They're going to end up shutting down schools in the United States. It's not going to be today. It's not going to be tomorrow. But I will tell you, there's going to be intermittent episodes and outbreaks where they're going to have to shut down the schools. And I'm certain those first cases of shut down the schools are going to happen in Washington. 100% going to happen in Washington first, where they're going to have to. Right. And so in the school district where my kids go, they have laptops to where that the schools pass them out. Like you as a parent, you pay for the insurance. So, if they break it, but they're high schoolers, you literally can virtual learn at home. Hi, Granny D. Excuse me. So, and Pure Mom Verns is actually in Washington State where all this is happening. And she has 2 little kids. So she's really concerned. And as a family, she has to be a stay-at-home mom because daycare for her kids is just astronomical. She couldn't even afford to work if she wanted to. Like, who could pay $700 or $600 a week for 2 kids to go to daycare? Like, it's just not even feasible for people. So that's my point. I think there definitely has to be some sick leave involved here. I think the government needs to step in. They have to understand that there has to be some kind of sick leave pay for these people that definitely get sick. Has to. Unemployment, it has to be something that they can do to assist these people. And there has to be a claims process. They have to figure it out, and they have to do it now, because that's the important part. Or else you're just going to keep spreading it and spreading it and spreading it and spreading it. Another thing, like me personally, I'm avoiding every high population event. Like, I wanted to go to, I wanted to go to a concert, and I was like, I don't think I'm gonna do that. So I'm just gonna chill, because I'm gonna avoid high population events and areas. 100% gonna avoid those things, like the plague, because if you don't have to go to malls, doctor that made us aware of it died back. He actually died. I think it was in January he died. The doctor that made everybody aware. He in December put out the alarm. In January, he contracted the coronavirus. And when people heard that he had died, China literally put him back on the ventilator and said that he was alive. But then said hours later that no, it was a rumor he died. Like, that is terrible. Like, the whole situation is just a mess. My suggestion to anybody is try to avoid high traffic areas. Another thing is like I shop still. So to me, when I go to the grocery store in the morning at 6:30 a.m., there's not a lot of people in there. And there's not that many people that haven't touched all those carts yet. When you go at 10:30, 11, 12, you have all those people. So at 6:30 in the morning, if I go to the grocery store, not only do I get the benefit of I can shop like discounted meats and produce and breads and stuff that they have there, because first come, first serve, like they'll have all the markdowns. I get what I need for my family, and it goes in the, it's all right, baby. It goes in the store. Like, I freeze it, definitely freeze everything, put it in an appropriate thing, put a date on it. 6 months from then, it's no good. So we use it. We rotate our little freezer. But also, you have the benefit when you go shop 6:30 in the morning. If the store opens at 6, who's in there but the employees? Hi, Affiliate Vibe on Live. Yeah, definitely stay at smaller settings. Yeah, no, I ain't doing all that. Soap will be next. Verns, if you can't find hand sanitizer, like I just found it at my Dollar Tree. And the most important thing is to understand, I almost said flavored. The hand sanitizers that are fragranced usually aren't at 70% alcohol based. Definitely wash your hands. Antibacterial soap is not going to help. PS, by the way, wash your hands. And what kills actually the germs is the friction. So, and you have to hold your hands downward. You need a paper towel to turn off the sink, because if you turn it off with your hands and you just wash, you contaminate yourself. So I think I'm going to do a hand washing video, because I've seen a couple and I'm like, sis, you just doing it all wrong. It's all wrong. So I did find these at Dollar Tree. These little Curad wipes. I use them for my phone. Definitely use them for my phone. Yeah, it's crazy they sell masks, because them regular masks aren't doing nothing. They need these. It's an N95 mask with a valve. So it's definitely, I know, right? But another thing that I was telling people, like, you have to remember, like, if you have to be shut in your house and you're going to have TV, we've been beyond exposed to it. So it's just how far into our communities has it gotten? Anyway, 1 second, Burns. I bought this at Dollar Tree, and the ethyl alcohol should be above 70%. And this one is, and it's the cheap one. And I bought the other bottle that goes with it. So my suggestion, yeah, if you find hand sanitizer, no, I got to track the package. I got to find the receipt, because, I'm nurse. I've been doing so much. I got to figure out where I put it, but I will. It should be there today. I think he said it should be there today or tomorrow, but I am going to track it. I have the customs receipt, Jamie. I sent Jamie stuff, so I'm going to try to track it. Another thing, like, you you're sitting there like hanging out and chilling with everybody. Like there's only so much Netflix you're gonna watch. There's only so much TV you're gonna watch. Like you're in the house 24 hours a day. You can't just order. You can't go shopping. You can't, like, how many movies can you watch? How much? Everybody's gonna gain like 20 pounds. So you have to preoccupy yourself with doing other things, whether that's watching YouTube, making YouTube, coloring. No, the type of mask that you're talking about won't help. This is an N95 NIOSH mask. This is an N95. This is the mask that you need, and it has a vent on it. This is not a surgical mask at all. This is the same kind of mask that we would wear if we were in a hospital setting. Like if I had to take care of a coronavirus patient, that's what I would use. Makima sold out. Someone was selling it for 50 pounds. I don't know why. Alcohol solution to wash your hands. They found 2 people yesterday, but I asked, what about people that had contact lens? You have industrial mask. you have an industrial mask and you need a hazmat suit. Well, if you have an industrial mask, you're probably going to need filters, and it's probably a P100 mask, the kind that looks like here, and then you got the 2 things on the side. So you definitely need filters for them. But definitely, if you don't plan on going out or plan on going anywhere, so I suggest you buy like board games, cards. Like you can go to Dollar Tree if you have little kids and they don't always find interest in their toys. No, that's okay. This man here, no mask, he just blew it. Girl, tissue in the trash. Please, here's my pet peeve as a nurse. Who told people to sneeze in their arm? Stop it. You sneeze in a tissue. Sneeze in a tissue. Have a tissue. Achoo. You put it in the trash. You go wash your hands. The problem is that America is so poor on actual hygiene, and children, they don't teach their children that they're so poor on hygiene. They're teaching people how to sneeze in their hand. It's hazmat suit for her kids. Stop teaching these kids how to sneeze in their elbow, because then when they put the coat on, they touch it. It's a false sense of security. And then you're putting your arms and your elbows everywhere. I don't think so. That's just disgusting. Stop. I didn't teach my kids that. And my kids, when the teacher would try to tell them to sneeze in their shoulder, my kids would look at them like they're cuckoo. Like, I'm not sneezing in my elbow. Ew. Like, what? Then you're going to take that shirt and you're going to wipe it everywhere and rub on somebody and y'all going to hug. Ew. Stop, America, please. Teach your children how to wash their hands. What happens to the wash your hands? 30 seconds. Wash your hands. Full of soap. Lather them up really good. Wash your hands. Teach our kids how to wash their hands. The same way you teach them how to wash their behind and brush their teeth. Wash your hands. Wash your hands before you eat. Wash your hands. If you're at school, school is part of the problem here, because the school doesn't let kids wash their hands before they eat or brush their teeth after they eat. They are part of the hygiene epidemic. And if you don't like the fact that my son is going to go out there and eat his lunch, and you want to have him permission to go wash his hands and brush his teeth, I don't think so, because you're not paying a dental bill. My son should be able to go wash his hands and brush his teeth. Like, hello, you do that at home. You should be able to carry those habits with you. Like, no, I don't think so. That's part of the problem, because the school's like, oh, well, we don't have bathroom passes and they really shouldn't be doing it. No, that's called personal hygiene, and you should be teaching it as well. You should not be teaching those kids that they don't wash their hands before they eat and they don't brush their teeth after they eat, because then they think when they're home they're going to do that, and that is not happening. No, you're going to brush your teeth. Like, I ain't got time. Yeah, it's part of the culture. Like, you should be doing that. Like, ew, I see some of these kids, I'm like, what you mean they won't let you brush? My man, that lady gave me a hard time trying to brush my teeth. Look at Nigel. Yum yums. They're my yum yums. You're a shasha big baby. So definitely no. Teach our kids how to wash our hands. 30 seconds appropriately. Scrub your nails, scrub it all. They should learn the right way. Like, stop teaching them to do backward stuff. Duh. Like I was saying, like, definitely have some kind of cards, games, dog to entertain you, besides the usual Okay, so coronavirus is a series of virus that is carried in many animals. It is carried in dogs, cats, birds. I'm sorry, it's in dogs, but it doesn't jump species in dogs. Really? I'm serious. It's a different type of virus. Hi, Trans Daddy. Can you get your boy? Because he's getting on my nerves. Definitely. What do you want, you creature? What do you want? You're not getting a snack for being obnoxious. So it's definitely what? Come up here. He just wants attention. But definitely. Excuse me, sir. Anyway, coronavirus actually is carried in many animals. Yes, Nigel's getting on my nerves. Girl, you about to have a dog. I'm about to put him in a box and send him to Japan. Coronavirus is actually it's carried in many animals, as we know from camels, dogs, cats, snakes, bats. Oh my God, what do you want? Hold on, I gotta go see what this one. He's trying to let me know something. What do you want? Come on, let's go. What are we doing? What are we doing? What? What are we doing? What? Oh, here. No wonder you're barking. There you go. That's why you're barking. Here. There you go. Gosh. He's still coming. I know he is. It's just going to be a matter of time. Girl, I'm about to roll back. Why are you looking at me like that? I thought he wanted food, so I gave him food. What? I'm not going to eat your food. Anyway. Oh, my God. Coronavirus. Oh, yeah. When he barks, he sets your dog off. My dog is so crazy. We all say that he's broken. Like, he'll get the food out of his dish, take like 3 pebbles and bring it out here and sit at your feet and eat them, and then go back to his dish. Coronavirus is a virus that's carried in camels, as we learned from MERS, camels, dogs. I don't remember if it was cats. I know it's bats, some snakes, different little viruses. It's carried there. It's jumped species 7 times. Chimpanzees. It's only jumped species 7 times in I think like since they were tracking the viruses, I don't know, for like 1700 years. So it's really it's only happened 7 times. So this is why scientists are really concerned about a coronavirus jumping species. Yeah, cats are amazing, especially right now. But the more that they learn about different animals, bats are a big carrier. And then there's some nationalities that eat bats, or they eat animals that get bit by bats or have droppings near bats. So it's a problem. Actually, the HIV virus was actually from, it's a virus that jumps species based on what is it? Simian infectious virus. It's like SIV. It's almost like HIV, but it's SIV that infected chimpanzees, which our DNA is very similar. So that's why HIV infected 150 million people worldwide, and 75 million have died. So viruses are very, 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 very dangerous to the human race. This is only the 7th one that has actually jumped species. I know I hear a lot of people talk about, oh my God, the worst pandemic we had was like the Spanish flu, blah, blah, blah. Okay, so let's talk about that, because the Spanish flu was in a time in American history where we didn't have infection control. We didn't have the Spanish flu. If it was in the times now, wouldn't have been as deadly as it was. We didn't have like the infection control things that we have now, gloves, gowns, mask. We didn't have all those high things. No, a human didn't have sex with a chimpanzee because it's not transmitted. It wasn't transmitted that way. It's transmitted through blood. It adapted to the human body, hence how it became a sexually transmitted disease. And it's also spread by blood. So that used to be the old wives' tale, but it was actually transmitted because people in that part of Africa actually eat chimpanzees and keep them as pets, as part of eat them as a delicacy. Hence how we have Ebola also. So, truth, facts. But that's the thing. Like, you have all these diseases becoming from all these places that eat these foods that they think are healing, or we don't have this here or that here, and so it's very detrimental to human hydasias. So it is 100% detrimental to the rest of us. So in the meanwhile, we really have to ramp up our infection control. You can get it more than once, which means that it's mutating. So I'll tell you that in a minute. So the Spanish flu situation, like, I hear that compared by a lot of people. If the Spanish flu occurred in these times, it would have not been as detrimental as it was then as it is now. We have infection control. We have all these things that weren't in place at that time. So I can clearly say that you cannot compare the Spanish flu to current times, because it was not, a lot of people did die, but it was because they didn't have proper infection control measures in place. Now we have it being made on the table of depopulation. You have a population of people in Africa. Like, you can watch any Ebola documentary. The people in Sierra Leone, where even currently now where there's Ebola, are still eating chimpanzees on their market. They're eating them because they don't think that they're infected or they're infected. We don't have Ebola here. There's plenty of documentaries about that. Like, there's plenty of stuff about that. The problem is that you have people that travel from country to country, or they cut themselves because, and again, goes back to infection control practices and people eating these delicacies, and they're infecting the world. And that's what happens. And everybody has died from it. Hi, baby. I'm going to go watch your premiere later, Kanisha. But 100%, that's what happens. And you've had a disease spreading and spreading and spreading and spreading. I remember I was a little girl in the 80s, and they said, oh, AIDS would be cured. To this day, AIDS is not cured. Yes, they have stuff that can decrease the CD4 count, and you do have meds that can help, but it doesn't cure AIDS. There is no cure for AIDS. Viruses are one of the hardest things to cure because they constantly and consistently will mutate. The minute that you have something that can potentially cure them or a vaccine for them, they mutate again. Hence why you can get a flu shot, and you can get an influenza A shot and you get influenza B, because viruses consistently mutate all the time. Or you may get a weakened version and you may not be so severe based on the fact that, because you had a shot. In my opinion, must coexist with the virus is possibly the self-isolation. The problem is you can coexist with anything. The problem is humanity isn't going to coexist with it. There's viruses everywhere. The problem is most can't jump from species to species. Most viruses, like swine flu, was a virus that actually could jump species. There were sick pigs. The people petted the pigs and touched the pigs, touched their face, touched wherever. And then you had a 40-person outbreak of swine flu. Mad cow disease. Like, you have all these things where there's instances of where things actually jump species. We're around viruses all the time. I may not be susceptible to what virus my dog might have or will get. But if I go around another dog, I carry the virus and I bring it to my dog. So that's why it's important. And that's why you see so many people. What do I think the mortality rate to be? I think the mortality rate of this virus is going to be, it's already surpassed SARS and MERS. I don't think it's going to be high as Ebola. I think more people, this virus is concerning because of the population of people it affects. Younger children between 1 and 9 are faring better off than a lot of people would assume. And they're showing the least amount of symptoms, which means they're more contagious and they're spreading it. I don't think it's going to get to 3-4%, but it's hard to say what the numbers are actually going to be because you don't have honest data coming from anywhere right now. And until you have this outbreak under control, you're not going to know. And I can tell you, and please mark that I tell you, remember that I'm telling you this. It is now March. It's going to be in the United States. It was in China. We'll just call it 3 months. It's all right, Jamie. So that's what it says. In transit, nurse soon come. Is that what the math says, or is that what you telling me? So here's the thing. If we had data from a lot of people that were honest, Italy, Iran is full of it because they have almost 3,000 cases right now that popped up overnight. Their health minister just literally contaminated everybody. You don't have accurate data right now. The average flu is like 0.2%. So, and we're talking China and all those places. I think you should be with this virus. I think going to be in the United States. I think the problem is that right now it's in places that don't have an extensive healthcare system. And my biggest concern is Africa. Africa is a big concern in South America because definitely Africa, you have a high density of population of people, and you are just establishing medical care systems and fresh water supply and hygiene practices, modern day hygiene practices, and supplying them with things. That's a big concern to me, and not necessarily for people like going with the United States. It's just a concern for me because like you're a human being, and I think you're going to be underserved, and I think their mortality rate is going to be higher based on the fact of the whether or not they have adequate healthcare systems in place to treat the amount of people that would actually be infected. And then you have some people that are older in villages that are less likely to be, willing to accept modern healthcare and not use other medicinal things. And I don't think that, that's their personal choice, but I think that's going to cause it to spread in Africa if they cannot control it. And that's my concern, just on that level for humanity, the human beings, honestly. I don't care if you're purple with green spots. Like, I really have a concern for Africa because there's a lot of places that don't have that established medical healthcare system, that don't have, there's some fighting and there's some war, and then there's an Ebola outbreak. Like, this is it's just a really, really bad place. Like the Congo, it's so bad to have any kind of outbreak right there right now. To have any of this on top of it, I think it's very dangerous. Even with good Medicare, I think it would be high. My concern when I seen it in the healthcare system, it was in a long-term care facility. In a long-term care facility, this is what I can tell you what happened. What you have is you're going to have a nurse manager, because I was a nurse manager at one point. So you're going to have a nurse manager. You're going to have maybe 2 nurses a shift and 6 aides. So you're going to have, and that's also on one floor. Say you have 2 nurses, a nurse manager, an ADON, a DON, and 60. So you're at least 10 staff, and you have activity staff and kitchen staff. So already just on one floor, you're talking about 20 or 30 people and 60 patients. So you're talking approximately on one unit, one floor, not counting, physical therapy, activities, whatever. So you might have, we'll just guess, on one floor at one time in your business office, maybe 110 people, including your staff during the day and your patients. Also think that a family are coming into the facility. So now say you have 20 people that visit during the day, and then you have EMTs bringing patients in and out of the doctor. One patient can infect, that is going in and out in the room, saying hello to everybody. One patient without proper hand washing of any one staff member can literally infect the whole building very quickly. Very, very quickly. You have people that come to the unit. You have this one go out. This one goes to therapy. They contaminate the gym. Then the other people come in. So it's very easy to contaminate a whole building right now. You also, on these units, what you have is what's called subacute rehab, which these patients are fresh from the hospital. They have a medical need. They might have surgical incisions. They just had a hip fracture. They had knee replacement. They're not necessarily clinging to life. They just had surgery, and they go to like a rehab center, which most are in long-term care facilities. They'll have like 2 or 3 floors that are long-term care for grandma and grandpa, which that's not all true anymore. Guess where your homeless and your drug addicts are now going? Yeah, they're all going to long-term care under Medicaid and all those federal programs. They're going in long-term care. They're homeless. They're 40 years old, and grandma and grandpa and cute in a rocking chair are not there like they used to be. You'd be surprised. It's not cute little old people anymore. There's some cute little old people, but a lot of them, it's not like that. So you have these population of people. They walk around. They're not in their bed. They're not cute granny. They don't want to play bingo. Then you have the population of where you have rehab, where you have people that have fresh open surgeries. They have staples, stitches, sutures. They're recovering. They're there 2 weeks, maybe 3 weeks until they get better. And then they get therapy. You manage their medications, and they go home. The problem is they're going to go home. They go in and out to multiple doctor's appointments. So if anybody on that floor gets contaminated, it's super. It doesn't take much. Like right now, they're saying some of the people that died in the nursing home my thing is, if you have people in the nursing home that are still affected, one, it's just like the Diamond Princess. It's like a petri dish right now. Anybody that is not at that whole place, shut it down. There's no reason that you have, I think it said 25 of 108 healthcare workers and like 20 something of like out of like 100 patients tested positive or had symptoms. Shut it down. Hi, baby. Shut it down. Like 100% shut it down. It should have never, like those patients, everybody that's there should, if they're not showing symptoms, they should be quarantined at home. Sorry, job, you're gonna have to pay for it. And the state of New Jersey, the state of Washington needs to implement and disperse those patients accordingly. And there should be 0 visitors to that nursing home. None, because all you're doing is you're allowing people to go in, touch a contaminated surface, say hi to their mom, and then go. No, mom, nope, sorry. You better figure it out, because they should have shut it down. And that's the problem. They're being too politically correct right now with people's health and wellness. Shut it down. The nursing home should have been shut down. When all this happened, the state should have been responsible to find placement for these people to where they could be quarantined in a section for 2 weeks and just keep it in a hospital, wherever it was. You have 100 people that you can quarantine. You have 12 hospitals, put 8 people in each hospital, or have a hospital that can accommodate, which you probably don't, and just shut it down and clean the entire building, quarantine the people, do what you have to do, because that's how you stop the spread and the community spread. But they didn't, because there's people on the news and they're still going into the building to go visit their mom and their cousin, and it's just going to keep going, because they're not stopping the infection, which is now what's going to happen in Washington, because they said apparently it's been spreading for weeks unnoticed in Washington, because some people are younger and don't have symptoms, which is a serious problem. It's a big problem. But that's part of the thing. That's part of the issue, because they're not stopping the spread while doing what's right. They should have stopped the travel, stop here, stop there, stop. And they're so worried about money and economy. That's part of what you. Anyway, like Nigel. This dog. Hi, Naturally. So definitely that's part of the issue. Stop. So that's part of the issue right now. It's definitely part of this. Hi, HD. That's definitely part of the issue, is them not stopping the spread of like cases that they know. Sit down. Stop it. Stop. Sit down. They're not doing what's right by stopping it. Hi, Sheesh. Hi, Deja. They're really not doing what they should be by shutting it down. Quarantine works right now. That petri dish of Princess Diana is going to blow out the rates of how easy it is to quarantine people. Those people, again, as you can see by that, like 1/3 of the people ended up being contracting the virus, and that's just so far. And they're still testing positive every day. Like they're just blowing out thing they know about the virus, like 14 days. And then, okay, it's past the 14 days and they're still testing positive. So the vaccine is not going to be a problem. I don't think the vaccine is going to be at least a year and a half off. And here's what I am going to say for people. They're more than 2 weeks behind. They're like a month behind. But here's what I am going to say. It is now March. By May, you're going to have widespread. March, you're going to start seeing little pop-up cases. You're going to have them here, there, here, little clusters of infection. You're going to have like, okay, this county. And Americans, we love our rights and like to use them. What you mean I can't leave my county? I have a right to leave. So they're going to try to quarantine people in counties in China, which they can. In the United States, we have rights they cannot. And people are going to exercise their right to not be quarantined and contaminate other people. Hence why most of the people are trying to get supplies, because they know they're going to want to stay in the house, because there are going to be some like constitutional rights bearing people that are going to want to risk everybody's health instead of keeping their behind in the house. So we all know it's going to happen. We all can see it from here. Any medical professional, I have a right. You can't quarantine me. We already know that you Constitution throwers, we know you're going to be using that. I would like to tell you, I have a constitutional right for you not to be stupid and infect me, period. But we all know that that's going to be their thing. Oh, I can't stay here. I'm not sick. And then you're not sick. And 2 weeks from now, 3 weeks from now, you have the virus, and then you're going to blame it on somebody wherever you went. Stupid is out there. We already know stupid is upon us. So the best thing to do, didn't one church mass? Yes, there was a church in South Korea. They made it explode. Yes, because they went to China, came back, and then they went and touched everybody, and they're like, oh, Jesus will save us. Okay. But you have to understand. Here's my philosophy. There's a story like they used to tell me like long ago, like when I was like a little kid, about this like stupid little joke where like there was this guy, he was in a boat and he was drowning, like, and the boat had holes and it was sinking. And there was like this big boat that came by and was like, hey, I'll help you. And he was like, no, Jesus will save me. And then the next guy came along, the next boat comes along like, hey, you need help? And he's like, no, Jesus will save me. And then the boat is filling up with water, and the next boat comes along, and he's like, no, Jesus will save me. So the man finally goes, like, the boat, he drowns, he dies, and God asked him, and yes, God. He's like, well, why didn't you save me? And he was like, well, I sent 3 people to save you. Why didn't you get on one of the boats? Same philosophy here. Like, we have to use common sense when it comes to this kind of stuff. And we understand religion. Like I seen, hi, Ivan. Don't know what you're saying. But here's the thing, when it comes to like this kind of stuff, you have to in Italy, maybe also Pope has corona, he has a flu. Flu and corona are 2 different things. So, but my best thing is that the whole church situation exploded. And then I seen this live stream and this dude was like, I'm going to, corona or not, I'm still going to church and I'm still doing all these things and I'm doing all this and we're still going out in the community and we're still doing this. I appreciate all your efforts and I really believe that you have a right for your beliefs. But I also, again, believe that you shouldn't be out there spreading this virus. I don't think that you should be out there in spreading to your congregation that things are okay. As you ride around in your BMW and your Mercedes and have your masks and your tithes are paying for your salary. So I don't think that should occur. I don't think that you should be like your tithes are being paid for by Pastor Bob, who lives in a $300,000, who goes on vacations, lives in $1 million house, and you're actually paying all his bills. I don't think that should be the person that makes your decisions when it comes to safe personal health and safety. I'm just saying. I'm not saying it's every church, but I'm saying it's out there in the world. I think if you want to pray and you want to be home, like God guide me, that's perfectly fine with me, because I'm certain he will find people that will guide you in the direction that you need to go. That's my spiel on that. But yes, definitely a church like made it explode. So I think people need to not avoid high population events and people, hundreds of people gathering, thousands of people. I know they're talking about canceling like Comic-Con. I heard they're going to cancel Comic-Con maybe. There's some other like big fair that they're talking about canceling. People are more worried about the money than they're worried about safety. And I grasp by the rules. I think it's a problem. I think you should be worried about safety. I think you should take that Comic-Con money, and I think you should go buy a bag of rice and some beans. Flu has 1 mortality rate. SARS had 0.2. Spanish flu had 2%. This has 6% in China, and there's no good numbers. Yeah, there's not good numbers. And the Spanish flu, if it was around now, wouldn't even have that much mortality rate, to be honest with you. Spanish flu is so big because you had no infection control practices, you had no vaccines, you had nothing. And it's essentially the case you have now. It is now March. I say, throughout the month of March, you're going to see clusters of places popping up. You'll see individual cases popping up. Then you're going to start to see clusters popping up. Then you're going to be in April, you're going to see larger areas of cluster here, cluster. It's going to get bigger. Come May, you're going to have widespread stuff. Here's the thing. If by May you have it widespread, maybe by July, August, you might have it under control to where you kind of can get it back to that level of that people are getting healthy and they're not, and the cases are starting to go down. Here's my question. That's July, August. What happens in September? October? November? Do we see a resurgence of this because this is something that you can get more than once? And unless the last person that has it is fully recovered and there are 0 cases, you're going to have this resurge one more time in the fall again. You're going to have it again. This is not going to be over. This might be now. And this is what I've been looking into, is whether if you don't get this under control, and CDC and the United States botched this so bad by not having testing in place and not quarantining people and not cutting the thing off, because you can actually have resurgence again during the cold times, the chillier times where you can have it again. You get it once, you can get it right back again, which means there's a problem because your body is not developing antibodies to this. So say I got chicken pox. My body, I'm not going to get chicken pox again because my body has built an immunity to it. Do I want it? No. And now I'm predisposed to shingles, but that's beside the point. But at least my body is not going to get certain things again. Like I may get one norovirus, but I'm not going to get the same exact virus because my body's like, hey, I know what this is. Okay, got it. I'm going to send the cavalry and we're going to attack this thing and it's going to be dead before you even start burping or feeling some kind of way. Good night, sweetheart. Good night, Burns. So you'll have that where you can get it again. It's already been proven that there's people that were tested negative, came out of isolation, went back into their respective communities and China, and then tested positive again. This has a herd immunity of 0. Yes, it absolutely has a herd immunity of 0. Which means what they don't want to tell anybody is that the virus has mutated. They don't want to tell you that the virus is mutated because there's no way that you would be able, as a healthy individual, you'd build antibodies and you would not be able to get it again. You wouldn't be able to get it anymore. And our body's immune systems are being taxed by many germs, many viruses, many things, like many different microbes, because of the fact that people are overusing bleach and they're not letting their kids play in the dirt. I mean, just simple stuff like where they build an immunity over their lifetime. Like they're like, no, scrub, clean your hands. Like they're just becoming too germaphobes. And their kids are becoming too germaphobes. So they're catching everything and their body isn't building an immunity. For the rest of us, like nurses, my kids, they don't get sick. I had a stomach virus and it lasted for 4 days. And I was like, dear God, help me. But my kids got it. My son took, you get this pounding headache with it. He had this headache And like he was like, "Oh, I'm taking a nap. I don't feel so good. Let me just go lay down." He woke up fine. Not even like 4 hours later, he was like better. I'm like, "What? You didn't even burp twice, and you're better?" Meanwhile, I was really bad sick, but my kids know you cover the toilet, you flush it. Everything hot goes in the burning dishwasher on steam cycle, and like in the minute anybody feels sick, it definitely goes in there. It goes in a steam cycle 100%. And then from there you go to like, okay, I'm really sick. I stayed in my room. I closed my door. Anything my kids would brought to me, soup, anything, I told them to leave it on my dresser. Like, don't come near me. I love you dearly. Plastic spoons, plastic cups, plastic everything. Don't breathe near me. Don't touch my door. They literally had gloves on. They wiped the in and outs of doors, in and outs of bathrooms. I use one specific bathroom in the house. They use another specific bathroom because that's what you have to do to I literally isolated myself from my kids. And so whatever my little weakened version my son got wasn't enough that his body couldn't fight off. So he's young, so he's 16. So he definitely had the immune system to boom. So, and that's what you have to do in this case too. You go in and out of your house. There's nothing wrong with wiping your doorknobs down. Like Lysol wipes are good every day. Honestly, I would use some bleach to wipe down your doors, your door handles, your toilet handles, all of that. Are there any viruses that don't bother children? I've always thought old and young were vulnerable. Very young are, in this case, it was really odd because they did a study and like kids between the age of 1 and 9 actually fared better than like pretty much everyone else. Babies, it's kind of hard to say. They recovered even though they have such a small immune system. I'm certain that babies are going to have one heck of an immune system when they get older because they've got such a serious virus when they were young. Definitely they're going to they'll be able to rebound easier. But the kids were showing the least amount of symptoms that I can think of off the top of my head. I don't know. It was weird. Like this is a virus. Like it's nothing like any other virus. And that's what people don't understand. They keep comparing it to flu. Like this is not flu. We know the course of flu. Flu looks the same pretty much all the time, like for years and years and years. Hence why we have a vaccine. We understand, okay, so this is what happens in flu when you get these respiratory symptoms. Sure. And this is what you do, and this is how you support it, and you do this, and this is what you do, and then like you have all these steps, and then you give NEP treatments, and you put them on isolation, and then you give them this, and then there's Famvir, which also helps. I think it's called Famvir. And there's medicine that they use like to help get rid of the flu faster. Like there's all these kinds of things that they can use for flu. Like, but besides that, there's not much for coronavirus except for supportive therapy. Meaning like oxygen, neb treatments, and ventilators. And there's nothing else that they're doing to really and maintaining their electrolytes. There's nothing that they can do to stop it until until doggies already easily get coronavirus, but they're not the coronavirus like we're talking. Doggies are actually carriers of a type of coronavirus, but the doggy coronavirus hasn't jumped species to humans. There's many types of coronaviruses. There's a coronavirus that causes a common cold. There's a coronavirus, which is COVID-19. SARS was a coronavirus. MERS was a coronavirus. That they're all coronaviruses. So there's many types of coronavirus. They're not just one. Coronavirus is a family of viruses based on its appearance because it looks like a crown. Like you ever seen the Burger King crown, like with the little spikes at the top? Like it looks like a crown, but it's a circle. It looks like a crown. And so those little tips of the crown actually are able to attach to the proteins in your lungs. No, that's good. Like a lot of animals carry it. I was saying, what is it? I don't remember if it was cats. I can't remember if it was cats because I don't have cats. I know it's definitely dogs, some birds, bats, camels. I actually did it in one of my first videos. I actually researched it to make sure that I was right. But it's definitely bats, camels, dogs. I'm going to say snakes. There's a couple of them. Yeah, bats carry a lot of viruses. Yes, they do. Yes, Dan, you are correct. Bats carry a lot of viruses. And people use them as a delicacy. They eat them, and sometimes hygiene practices when it comes to other animals in other countries is really not sanitary, and that's where some of this stuff comes from. It really does. Like, you hear all these theories, but guess what? It's not that. You have people eating chimpanzees. And that's where AIDS came from. Yeah, somebody that was preparing chimpanzee, they had a cut on their finger, like I have right now. I got hangnails. I don't know if you can see them. I use my hands a lot. You see all my little hangnails, and I have open skin, and I even have to cut the blood, and I can go in there and I can prepare chimpanzee, and the chimpanzee was infected, and guess who else is infected? Boom. And guess what? You're now you go and you're with your husband and you have babies, and then say you're preparing food for other people and you have cuts on your hands, and you're doing all this stuff, and guess what? All that stuff is being shared because they're eating monkey brains raw or whatever their delicacy is, and they have them as pets, and then it's just spreading. The same thing happened with the Ebola virus. If you look up the Ebola virus, death rate is 60%. If you had a worldwide spread of Ebola virus, it would wipe out at least 60% of the population of the world. The Ebola virus is serious. So serious. Like, people need to be, and the Ebola virus is still in Africa right now, and people don't believe it because they didn't believe the Ebola virus was here. There's plenty of documentaries on it. You can actually go look them up. You can watch them. Ebola virus is a serious virus, and where it came from. And you can watch plenty of that stuff because people are eating bats and chimpanzees. Definitely. And that's the problem. Or you have bats that are in the vicinity of other animals, and so they're around the bat poop and they're contaminated and there's not fresh water. It just goes and goes and goes. So me personally, I'm staying away from sick people. What? I love you. Come here. My dog is crazy. Oh my God. I love him. I would definitely stay away from sick people. Try to buy some small little buy some canned goods, or definitely try to have some bleach on hand. Wipe common areas with bleach. Doorknobs. Please don't forget about your keyboard, your phones. Of course, like lamp switches, light switches, all those things are common areas that I touch, you touch, the kids touch, the doorknob. All those things, all your electronics, those things need to be wiped off. The refrigerator handles, stove handles, all those things need to be wiped off because they all are common areas that people touch. So I suggest you definitely 100% wipe those off. And if you can't find hand sanitizer, go find rubbing alcohol. It's definitely out there. My dog is going to irk my soul. Come here. Ah, you're like a big baby. I got food for you too. See this? He is like my child. This is my monster. For anybody who doesn't know, Nigel. He's such a good boy. He is. He's a good boy. Stop looking at my face. You do other stuff with your mouth, like effing. But definitely always remember. You're going to stop barking at me. That's what you're going to stop doing, or you're going to get down. But also remember, like, try to think about your neighbors. There's a lot of elderly neighbors that some of us have, and depending on your community, and you may have the opportunity to go out and buy certain things. Please don't forget about your neighbors that don't have that opportunity. Fur babies are the best. This one irks my nerves. I love my fur baby. He sleeps in my room. He's like all over me. So if he ever gets coronavirus, which I doubt think will happen, we all done it here because he's like our protected. Come here. You're so pretty boy. But definitely, please be mindful about your neighbors, especially your elderly neighbors, to make sure that you keep an eye on them if they have food, if they get sick. If your elderly neighbors get sick, please be mindful. If you know any of your elderly neighbors and you stop seeing them for a couple days and you realize that they're sick, please, you don't even have to do it personally. They have something called like safety checks. If you haven't seen your neighbor in a couple days and you're really concerned, it's 100% okay to call the authorities and be, hey, listen, Mr. Bob lives next door. He had a cough a couple days ago. I haven't seen him in like 2-3 days outside. Can we do a safety check on him to make sure he's okay? A lot of communities have safety checks. And I think that, we have to not only be mindful of our neighbors, because this is going to be an issue. Move, Nigel. We need to take care of each other through this, because that's the only way we're going to get rid of it. And I think we might have a long-standing problem, because I definitely think it's going to be a long-standing problem if we don't get it under control right now. Bleach is your friend. Cover your toilet. Bleach everything as much as you can. Bleach kills a lot, including the HIV virus, which people don't know. What? Oh my God, this dog. But make sure you do wash all your common areas. Nigel, meet everybody. Meet Nigel. So anyway, my loves, I'm about to jump off. But definitely try to take care of each other. Just go shopping, figure some things out, what you need. Nigel! My dog is so broken. Yeah, shut the lid. Even when you poo-poo, ladies too, you pee or you poo, close the lid and shut it, because you definitely don't want that stuff spraying everywhere. Oh. Definitely. Teach your kids how to close the lid when they pee and poo, because that's just good hygiene practices. And spray the lid, like bleach the lid. Like I keep bleach in my bathroom, like a bleach spray. So if they go potty, like they can spray that down. You don't want that. You next on the toilet and you got like in your butt cheek, you got like stuff on it. So no, spray that down. After it's time, keep it moving. Gosh, I love my dog. But anyway, my lovelies, oh my God, I want you guys to have a great night. I think you should keep eye on not only the national news, definitely keep eye on your local news, because your local news is going to tell you about cases in your area, because a lot of times the national news media is not picking up on cases. I think if you have any friends or family that are nurses that work in hospitals, I think you need to definitely pay attention to them, because they definitely know what's going on, because it's definitely going in and out and it's in front of our eyes and we have no way to test people. So 100%, that's what I'm telling you. Just stay safe, everyone. Please, definitely wash your hands. If you wash your hands a lot and use hand sanitizer, please go find, there's something called like Utter Balm or like Carry lotion, like good lotion for your skin. You had a doctor yesterday in Sydney. If you use a lot of hand sanitizer, please be mindful that your hands will dry and crack. Please use a lot of, you can get Carry lotion, or there are good lotions. Don't get fragrance lotions. Like Aveeno lotion is good. Get healthy lotions for your skin to keep your skin hydrated after your hands are clean. And that's what I'll tell you. I just think everybody should be safe. Pay attention to your local news. Wash your hands 30 seconds, downward motion before you eat, after you go to the bathroom. Don't touch. Listen, here's my suggestion. When you go in and out of stores and the pretty little rails for you to push the door open, I'm sorry, sis, I'm hitting the glass. I'm sorry, I'm hitting the glass. I know how many hands have been on that door, and I can see somebody's handprint on the glass. I'm sorry, y'all. I'm hitting the glass already. I'm letting you know, you're going to see my big old man handprint, because I am not touching that rail that everybody done walked in and out the store with. And no got automatic doors. I'm hitting the glass. I'm touching the glass to get out. Like the center of the glass to push the door. I'm not getting the edge and I'm not getting the door handle. I'm touching the glass. Hate me if you want to. But yeah, definitely wash your hands. Keep hand sanitizer with you. Make sure it's at least 70% alcohol. If you cannot find hand sanitizer, try to find some rubbing alcohol. I know it's more stable in that base, but at least you will have something going on. It's better than nothing. But definitely wash your hands with soap and water. 100% soap and water. That's an absolute must. Teach your kids to use it. Wash their hands with soap and water. Lots and lots of this. It should be like lots of interlocking fingers, but you're holding your hands down. Lots of friction, because that's what kills the germs. Lots of friction. Lots of friction with the soap. Lots. Teach your kids how to wash their hands. If you can't find a video, look it up. Find a video. There's probably one on the CDC that says about washing your hands and hand washing. Vigorous hand scrub. Vigorous is the word. Vigorous hand scrub. 30 seconds. Sing happy birthday. I don't care if you sing it twice. Teach your kids how to wash their hands properly, especially after they eat, before they eat. All those things are important. And so you can do that. Don't do that. Because then you can put the corona booger on the next thing, and I just can't. Don't pick at your nose. So please make sure that you buy a little stock of food. If you want to buy an extra case of water, that's fine. Try to think about what you eat. Make yourself a list. I'm gonna go with Pure Mom. I'm gonna help her later figure out a list. And if you're a little more economically challenged, try to hit up your Dollar Tree. Try to shop the sales. Go 6 o'clock in the morning and go to the grocery store, because a lot of times they have discounted items. They have discounted sections in most large grocery stores. So you should be able to go and shop those sections. A lot of things, bagels and stuff like that, does freeze well. So you 100% can put them in the freezer. White bread, not so much. Multi-grain bread does. Definitely go through, see what you need. Ladies, girly products, 100%. Where it's 50 or over. Yeah, it is. It's spreading a lot of different places, whether they're 50 or over. There's people that are 39. She's 39 and she's in Manhattan. She has the virus, and she was a healthcare worker. So how many people did she take care of? And she's healthy and she's fine and she's home. But we have to understand that this is a big deal. And as much as I've been saying it's a big deal, people don't want to listen. Hopefully they have their eyes raised now and they're at attention. And, buy the essentials that you need first, and then just go from there and make yourself a list, make yourself a budget. I know people get paid, but again, 10 pounds of potatoes is a wonderful thing. And if you have neighbors that you're really good with, and you know that if something happened, like you buy potatoes and they buy pasta, like seriously, it should be a co-op of people that you live with that should be able to help each other. Like you should be able to build a meal if you are in a neighborhood community and there's 10 houses. Like you should be able to count on each other to help each other. And I think that's a lot of the problem we have today. People don't help each other no more. So be mindful of your neighbors. I think everybody should love each other. Wash your hands. Stay home. Definitely help each other and love each other. Stay away from sick people. But at the end of the day, like if you notice some of your people, the elder people around you are sick and you haven't seen Mr. Bob in a couple of days, I would be like, hey, you can call the police and do a safety check on Mr. Bob, because sometimes it's 100% important that maybe Mr. Bob is ill and he can't get to the door or come to the door, or maybe he's sick and you don't want a bunch of people going knocking on Mr. Bob's door and he has an infection. So it's very important that we do safety checks on our elders, on our parents, on our siblings, and be prepared. Not only that, maybe it's you at your house, maybe you have 2 or 3 other family members that might have to stay with you during an episode. Like if you live here and your mom was somewhere else, or your dad, or your couple of your siblings, please be mindful that you may have to have a little more stock of food, because people are going to be at your house, and toilet paper and other things. Anyway, guys, I'm going to jump off. I have some work to do, but I just wanted to give you guys a heads up. And please remember, I love you guys. As a nurse, there's plenty of us out there, and stand up for us, stand up for your nursing professionals, and realize that we're on the front lines. I'm one of the people. I'm a very personal person. I'm willing to help anybody. If you need a list, I am on Instagram. It's this Rethink Nurse on Instagram, just like my name, no spaces. Find me on Instagram. I'll happily help you, and maybe we can talk through a list of what you might need to get, or something that I need to help you get, or you need some ideas. Queen of ideas. And anybody, PS, by the way, get a 90-day supply of your medications from your pharmacy, 100%. If your insurance won't pay for it, tell the doctor that you want to get a prior authorization done based on the fact that there's an infection in this country. Excuse me. That could potentially cause you to have a disruption in your medication, and they need to authorize it. So with that being said, I love you guys. I hope everyone has a wonderful night. Take it easy. I'm going to take Nigel out before he makes me nuts. All right, guys. Think about what your meal planning is going to be, your water plan, your money plan, all those things. Always have a plan. Be proactive and not reactive. If you don't live in a hot zone right now, you're being proactive. Nursing and medicine is about being proactive. I cannot say this enough. Hugs back. Proactive. You are proactive. You cannot be reactive. You cannot wait till it's on your doorstep. You have to be proactive. Proactive, proactive. That's what gets it. Anyway, my loves, remember, proactive. Be proactive. I hope everybody has a wonderful night. I will catch up with y'all, and I'm going to try to go to all these and see what kind of stuff I can do canned good wise and other food. Anyway, I love you guys. Take it easy. Oh, and don't forget, like, if you fry stuff, buy oil. Oh my God, I forgot to tell you guys to buy oil. Like with your condiments and your ketchup and stuff, buy oil, because you're going to want to fry French fries or whatever, and you're not going to have that. Anyway, that's my last little bit. I'm definitely going to bed. I'm taking it easy. I'm going to do something else. I love you guys. I hope you have a wonderful night. Dishes. Love everybody. Stay safe and look out for each other and love each other.